In the very heart of Africa's largest population, rising from ancient hills and rocky giants, stands a young city with an old soul. Nigeria's Federal Capital Territory, Abuja. A city known for its beauty, vibrance, and affluent display of wealth and power. Beyond the ever-thriving and bustling capital city lies Yangoji, a forgotten leprosy colony, isolated by stigma and battered by disease. In this community, located just 72 kilometers away from the city center, the same people fighting one of humanity's oldest illnesses now face an even deadlier enemy, and it is malaria. As the sun sets over Yangoji leprosy colony, mosquitoes hum over the ears of people seated within its boundaries. Homes roofed with rusted zinc leak during the rains. Broken doors allow pests and disease-carrying insects easy access. For residents, nightfall often brings fear, not rest.
Life here is extremely difficult. We are suffering. Our clinic has no drugs, and we don't have a doctor or any stable health worker to attend to us when we fall sick. The structures are old and worn out, and the zinc roofing sheets are damaged. During the raining season, we suffer the most. Our children are in school, but every term we are required to pay at least 30,000 naira per child, even though we have no stable source of income. The challenges here are overwhelming. When we fall sick and go to Kwali Hospital, we are not properly attended to because we don't have money. Sometimes we end up sleeping on the floor. Even though we have a hospital in this community, there are no drugs, no doctors, and no equipment. Malaria is one of our biggest problems. When it strikes, we suffer a lot. Recently, a man became severely ill from malaria and eventually died because he couldn't get medical attention. Just last Wednesday, my son fell sick with malaria and it became so serious that he needed a blood transfusion.
Nigeria prides itself as the giant of Africa, yet it bears one of the world's highest malaria burdens, with an estimated 68 million cases and 194,000 deaths in 2021. Authorities say malaria is one of the top 3 reasons for hospital visits in the Federal Capital Territory, especially among children under 5 and pregnant women. Though metropolitan areas in the FCT enjoy better equipped hospitals and private clinics, informal settlements, rural communities, and people with special needs settlements like Yangoji Leprosy Colony experience some of the highest malaria burdens in the territory due to poor housing, limited drainage, and inconsistent access to preventive tools like treated mosquito nets.
2 Saturdays ago, I took my child to the hospital. They charged 2,500 naira just for the hospital card. Then, they said they needed to test her blood and asked me to pay 6,000 naira. I told them I didn't have that amount, so they collected 5,000 naira instead. They also took 1,800 naira for the syringe and other small charges. After that, they admitted her. I had to return home to borrow 10,000 naira from our leader, the Sarkin. With the money he gave me, we went to the pharmacy to buy the prescribed drugs. The total bill was 31,500 naira. I told them I only had the 10,000 naira I borrowed, but they refused to give me anything. I had no choice but to take my sick daughter back home. She was suffering from malaria. We first took her to our clinic here and they confirmed it was malaria before we went to town. But because we couldn't afford the costs, I had to bring her back home again. Our biggest problem here is poverty. Even the little food we farm does not last more than 3 months after harvest. Once the food finishes, we go out to beg. But begging is no longer like before. Sometimes we go out all day and come back with nothing.
A clinic stands at the heart of Yangoji Leprosy Colony. Its windows cracked, and inside, the shelves meant to hold essential medicines are lined with emptiness. Adamu Sarki, a youth leader and the community's health worker, says the facility has been out of basic malaria drugs for months.
That since 2012, we are not received any drugs from the government. We are only received drugs from some organizations like Leprosy Mission of Nigeria and others organizations. The true government, we are not received any drugs from them. And I am the head workers there. I really see a different challenges because like a pregnant woman, when they have an issue around that kind 12 o'clock or 10 o'clock, we don't have car to take her from this clinic to other hospital. So some other women lose their life.
Yangoji Leprosy Colony, officially known as Alheri Special Community, was established in 2006 by the Federal Capital Territory Administration under former President Olusegun Obasanjo. Its goal: to resettle people affected by leprosy, offering care and dignity away from the city center. But as funding declined and attention faded, the settlement slipped into neglect. Today, more than 600 people live here, isolated by stigma, battered by disease, and trapped in poverty.
Ciwo kowa ya san daga leprosy sai wani ciwo da aka ce ma ulcer.
The illnesses we face most often are ulcers, stomach pains, and malaria. When we fall sick, there is no medicine. We rely on traditional remedies like herbs and leaves that we boil and drink. Even I, the king, suffer from neck pain. We have no doctor, malaria is rampant, and many of us are sick. Successive governments used to visit and give us donations, but the Tinubu government has neglected us. Does the government not know that people affected by leprosy exist? Other states receive welfare support, but here in the FCD, we are forgotten. Are they waiting for us to die before noticing us? We want the federal government to see us as human beings created by God. For years, we have depended on foreign assistance, but since they left, our conditions have become deplorable.
Advocates argue that the root of the crisis is not simply drug shortages, but the continued invisibility of leprosy settlements in public health planning.
The health system generally in Nigeria needs a lot of work. Now, if we start from there, you would almost alleviate some of the problems that has to happen. The funding landscape is changing. And leprosy is a disease that's classified under entities, which is neglected tropical disease, which means that there's not a lot of spotlight on those diseases. What that also would mean is that because a lot of people because it's not being spotlighted a lot, it means that getting funding or resources to be able to implement your ideas towards elimination of that disease can be a bit of a challenge. So one of the things that we hope that we can recommend is for the government in itself, we recommend that they show more commitment. We should not be having instances where drugs that have been made available or persons affected by leprosy are not able to get to them.
Nigeria operates two major health frameworks aimed at protecting vulnerable populations: the National Tuberculosis, Leprosy and Buruli Ulcer Control Program, and the National Malaria Elimination Program. Yet, for people affected by leprosy, these parallel systems leave a dangerous gap. Leprosy is acknowledged in one program but under-prioritized and largely invisible in the other.
Da ciwo ya same ni gaskiya ba na jin daɗi. Saboda
Since I developed leprosy, I have not been happy. Whatever happens, I'm always left behind. My friends and family are living their lives while I remain stuck here. When I was in the north, I used to attend school. I was in primary 4 when leprosy struck me. After receiving treatment, I stopped going to school. I was only 6 years old when the sickness started. At first, we thought it was a skin disease, measles, or something spiritual. My family took me to a spiritual healers for help, but it did not get better. In fact, it became worse. Sometimes I also come down with typhoid, and most of the time, it is my mother who takes care of me.
What we're doing on primary healthcare for millions of Nigerians, if government doesn't do that, they will be tipped into poverty because of cost of healthcare. If they don't have health, they will go and they cannot go to farm, they cannot go to trade. And cancer care, if we don't provide it, to spend $100,000 to go abroad for medical care can bankrupt someone. So that is one aspect. But there are also policies on child health or maternal health. There are things on fistula that we're doing, for instance, free fistula for every woman who has obstetric complications. That's also to deal with the poorest and vulnerable who need our support.
In the 2025 budget, the health sector was allocated 2.48 trillion naira. While there is a budget line for health promotion and disease prevention, no publicly available breakdown of the health budget shows earmarking for diseases like leprosy. The fact that Nigeria suffered drug supply disruptions for leprosy as recently as 2024 suggests that existing budget and funding allocations have not been sufficient to guarantee uninterrupted leprosy care. Yet, amid the hardship, resilience endures. Women in the community trade and farm to support their families. But these efforts, residents say, are not enough. Leprosy, also known as Hansen's disease, is a chronic infectious illness according to the World Health Organization. It affects the skin, peripheral nerves, the lining of the upper respiratory tract, and the eyes. In Nigeria, it remains a significant public health concern, with more than 3,500 new cases detected annually. While studies showed that it is now fully treatable, the communities created for its survivors remain some of the most underserved and overlooked places in Nigeria. And until help reaches them, the fight against malaria, against neglect, and against poverty remains far from over.